New variants, vaccine mandates, immunization in children and pregnant women, and booster doses. Here's what's coming next in our battle against COVID-19. Hi, I'm Dr. Yvette Lu. I'm a family physician. COVID-19 keeps throwing new challenges at us. We made it through the first wave, the second wave, the third waves of COVID, and now here we are in the fourth wave. Cases are high again, and our ICUs are full of people fighting COVID-19. The difference is that this time the virus is predominantly hitting people who are unvaccinated. Even though the COVID vaccine has been available since the beginning of the year, there are still people who have not yet gotten their vaccines. These are the people getting seriously ill during the fourth wave. Last week, here in my province in Canada, over 90% of people in the ICU were not vaccinated, and 100% of people in the ICU under the age of 40 were not vaccinated. The fourth wave is a pandemic of the unvaccinated. If everyone was vaccinated, we wouldn't be in this situation. The vaccine works well at keeping people who are vaccinated out of hospitals. The other factor affecting the fourth wave is the spread of the Delta variant of the coronavirus. Let's talk about variants. Viruses naturally change over time due to mutations, and this can lead to new versions of the virus, known as variants. The Delta variant is spreading rapidly right now. It spreads more easily and causes more infections than earlier forms of the virus. It may also cause more severe illness than previous strains of the virus in unvaccinated people. If you're vaccinated, you can still catch the Delta variant, but you're less likely to get seriously ill from it, and you're less likely to spread it to others. The Delta variant is the most common variant of concern right now, but there are other variants waiting in the wings. There are quite a few variants that we're watching, actually. Variants are classified into variants of concern and variants of interest. For example, a new variant was recently added to the variants of interest list, the Mu variant. The Mu variant is of interest because it contains mutations in its spike proteins that may help it escape immunity from vaccines or previous infection. Luckily, it's not as contagious as the Delta variant, but in lab studies, it's better at evading vaccine-created antibodies, which means that it could lead to more serious infections and another rise in cases if it becomes more common. The Mu variant has taken hold in Colombia and is responsible for more than a third of the COVID-19 cases there. In North America, the Mu variant has been detected, but it is not considered a threat at this time because case numbers remain low. The Delta variant is what is keeping us busy here. The best way to beat the variants and to prevent new variants from emerging is by getting as many people vaccinated as possible. Variants take hold in places where people have no immunity to the virus. If vaccination rates are high, then new variants can't gain traction and they die out because they have nobody to infect. This is called herd immunity, and it's why it's important for people to get vaccinated, not only in your community, but around the world. If there are large numbers of people around the world who are susceptible to the virus, new variants can develop there and then spread worldwide. Let's move on to vaccine mandates. As our fight against COVID-19 continues, we're going to see more vaccine mandates and passports. Asking for proof of vaccination is nothing new. I had to show proof of vaccination prior to going to medical school, and most healthcare jobs require proof of vaccination or immunity or both. Many summer camps, schools, and preschools also require proof of vaccination. If you've traveled to South America or Africa in the past, you will know that proof of vaccination is required to enter many countries there. Having restrictions based on vaccination status makes sense right now because the pandemic is being perpetuated by unvaccinated people. People who aren't vaccinated are primarily the ones getting sick. They're the ones in the ICU, and they pose a health risk to others. Vaccine requirements keep the transmission of the virus manageable. They allow us to keep businesses open and to prevent from going into lockdown again. If vaccine requirements are not implemented, there will need to be widespread closures again to completely avoid overwhelming hospitals, which are already stretched to the limits. Our hospitals are not an unlimited resource. And when they're overwhelmed with COVID-19 patients, other procedures like cancer surgeries and heart surgeries have to be canceled, and people suffering from emergencies like heart attacks, strokes, and car accidents can't get adequate care. Think of vaccination rules like smoking. We don't allow smoking in many public places because it endangers the health of others. Choosing not to get the vaccine also endangers the health of others. You can choose not to get it. That's your choice. But it means that you shouldn't be in public places right now because the chance of you spreading the virus is too high. In a similar way, we require people to hold a driver's license in order to drive. The license shows that you have passed certain requirements and know how to drive safely, and that hopefully you are not a hazard to the public. I know there are lots of bad drivers out there who have licenses, and it's not a perfect system, but you get the idea. The goal is to reduce harm to others. In the same way, vaccination rules reduce harm to others, and they're important right now when hospitals are on the brink of being overwhelmed again. Other than people who are unvaccinated by choice and people in countries where the vaccine supply is limited, the next largest group of unvaccinated people are children under the age of 12. This fall, we will likely see more cases in this age group because they are among the unvaccinated and, therefore, as a result, they are more vulnerable to getting infected by the Delta variant. Luckily, most children can recover from COVID-19 without hospitalization, but we still do see serious cases and even deaths in children. And when they're unvaccinated, they become more easily infected and contribute to the spread of the virus. That's why it's important that children over the age of 12 are vaccinated as soon as possible, and that as soon as the vaccine is available for children under the age of 12, that they be vaccinated as well. All medicines, including vaccines, have side effects, but any adverse effect that your child could get from the vaccine would be much worse should they get a full COVID-19 infection. Put another way, the chance of having long-term consequences from a COVID-19 infection is much higher than from vaccination. The vaccine is a tiny piece of virus. It's a tiny piece of the virus's coat in your body. The infection is the full virus. It's like comparing the damage a shark's fin could do versus an entire shark, teeth and all. The virus is like the shark's fin. The fin alone can't do much. It needs the rest of the shark to cause trouble. Currently, the mRNA vaccines are being tested in children aged 6 months to 12 years old. If you're in a large city and you'd like your child to be vaccinated early to get them early protection, you can sign up to be part of a study. The studies are being done to monitor side effects and to figure out the effective dose in children. The dose in children will be lower than the dose in adults, and the study results will be available late in 2021. Expect that vaccination in children aged 6 months to 12 years will start late this year or early next year. I'd like to mention pregnant women as well here, as some pregnant women have been reluctant to get vaccinated, many of them due to misinformation that is out there. Pregnant women have been getting vaccinated since January. Studies have now been released showing that there is no excess of adverse effects in pregnant women or in their babies who have received the vaccine. Once again, it is true that we don't have long-term studies. But what we do know is that pregnant women get sicker with COVID. They have a higher chance of hospitalization and ICU admission. If you're worried about what the vaccine might do to you and your baby, think instead about what the virus would do to you and your baby. The chance of long-term side effects from a COVID-19 infection on you and your baby are much higher, and consequences are more serious compared to anything that the vaccine could do. All major obstetrical organizations are now recommending that getting the vaccine is the safest choice for you and your baby. The last thing I'd like to discuss today is booster doses. Vaccine booster doses have already begun in some countries, and we will be seeing more announcements about booster doses in the last part of the year. After you get a vaccine or get infected with a bacteria or a virus, you build antibodies. Your antibodies are like little soldiers that roam around your body looking for the virus. After a period of time, however, if your antibodies don't see the virus, your body thinks that you don't need them and it starts making less of them. And then as a result, you may not have enough antibodies to fight off an infection when you actually encounter it. This is called waning immunity. Booster doses expose your body to a little piece of the virus again, reminding your immune system that the virus is still a threat. It's like doing training exercises to keep up your fitness. We're training the immune system to stay alert for the virus. We're going to see booster doses in high-risk populations first, like people who are immunosuppressed, cancer patients, organ recipients, and people in long-term care. Some people in North America are already receiving booster doses. For everyone else, the current estimate of when we will receive booster doses is probably early next year. Many countries have held off on providing booster doses because it's important for people in countries around the world to get their first 2 doses before we start getting our 3rd dose. As I explained earlier, this helps with the overall control of the virus by preventing its spread and by preventing variant development. Okay, that's all I have for today. Thanks for sticking with me. If you're not vaccinated, get your vaccine as soon as possible to protect yourself and those around you. I'm Dr. Yvette Lu. Stay safe and see you next time.